Distinguished ladies and gentlemen, it is for me a real pleasure to be here this morning to join you in this policy forum. I want to thank my previous speakers for laying out the agenda so well, and thanks to the Thai government representative for the warm welcome which he has bestowed on us and for the kind hospitality that we have already started to receive from the moment we arrived at the airport. I want to thank the colleagues of FAO for the leadership and the partnership that was established in preparing this seminar. Crisis and sensationalization have tended to influence the vicissitudes of the livestock sector. Scarcely have we had the dialogue which we're going to have in the next 2 days to forge the path which we may pursue. It is therefore a great pleasure to be here and to be part of this dialogue. I was asked to speak on the topic health at the livestock policy interface. I want to say at the outset that much of what I'm going to say I've derived from my colleagues at Hillary, and Delia Grace, who is in the room, has been a key supporter in the preparation of this discussion. In discussing this topic, I want to briefly go over 3 main topics. First, the global trend in meat and milk. We would hear about this many times during the course of this week, so I'd be relatively brief, but with pause to emphasize a few particular points. Then I'd like to talk about the 3 healths of the livestock sector: human health and nutrition, animal health and ecosystems health, the main body of my discourse. And then at the end, since we're talking about health, medics tend to prescribe, and so I will do my own prescribing by offering a few prescriptions and points of policy advice. Before I do so, for those of you who are not familiar with ILRI, I would like to introduce ILRI very briefly. It's an organization with about 700 staff, 54% of which are from the developing countries. 54% of the technical and scientific staff are from developing countries. More than 30 scientific disciplines, a budget of about 60 million. And ILRI works with a range of partners, national and international, and on a range of topics from that relating to productivity of livestock, policy markets, and environmental issues. So back to my outline, I want to start with a brief survey of the trends in meat and milk in the livestock sector. The first thing I want to say is that livestock are numerous, and they are more numerous in developing countries than they are in developing countries. And there is no region in which they are more numerous than in Asia, where 70% of the poultry, 44% of the sheep and goats, the term in Africa for used is shoats, and 49% of bovines and 84% of the pigs are here in Asia. So livestock are indeed numerous, and the darkness of the map connotes where the intensity is. And as you can see, India and Southeast Asia are important points of densities. The next point I would like to make is that a large number of poor people depend on livestock. Those who depend on livestock, the poor living on less than $2 a day, 70% of them are rural, and 25% of them are in urban areas. But amongst this group of people, 600 million are in South Asia and 300 million in Sub-Saharan Africa. And if we were to categorize the livestock agricultural systems into 3 types: traditional agricultural societies, transforming societies, and urbanized societies, you can see that agriculture GDP is relatively important to the first two, declining in the last. But in all of them, the GDP contribution of livestock as a proportion of agriculture is large. And smallholders have a particular opportunity in the transforming and traditional societies, with the caveats that my colleague Nepen just alluded to. It is true, as Dr. Nepen has said, that the livestock sector is industrializing and rapidly. However, even in poultry, the most industrialized of the livestock sector, the presence of flocks in rural households are still very prominent. We can see, if we look at Cambodia, Vietnam, and Thailand, that in the case of Cambodia and Vietnam, in both the quantity and the number of flocks, smallholders, backyard systems predominate. In Thailand, however, most of the meat is produced in industrial systems, but still a large number of flocks in smallholder systems. 4 billion people living on less than $10 a day, with an aggregate buying power of about 2.9 billion. As you can see from this graph, per capita consumption, even with that buying power, per capita consumption of meat is still low in the developing world as compared with the developed. However, the total amount of meat consumed in the developing world is much larger. And given the relatively low per capita consumption, the amounts of meat consumed, meat and milk in the developing world, as in relation to the developed world, will continue to increase over time. So given the new mobility and the rapid growth in demand for livestock products, one can well imagine what the new mobility of the livestock sector would look in 50 years' time. And in that context, the implications for all the health systems that I will come to in a moment. When we talk about livestock sector in many countries, people like to go to the export sector very quickly. Clearly, countries would like to use the livestock sector to earn foreign exchange and to grow economies rapidly. However, it is true to say that whilst trade is increasing more rapidly, much more rapidly for pig and poultry than it is for beef, trade is only about 10% of aggregate livestock production. The point I would like to make is that while trade is important, local markets in most developing countries matter more. And there the question of food safety, as Dr. Nepen has already said, is key. Time would not permit me, but whilst there is the old wives' tale that smallholders or poor people do not care about quality, we do have data to show that they do, and they are inclined to pay for safe products, as are those people in the more sophisticated markets. Ladies and gentlemen, let me turn now to the three healths that we'd like to talk about, and livestock is crucially related to all three of them. Human health and nutrition. One can say that nutrition is an essential component of health. And then discuss animal health itself and ecosystems health. My point, the underlying point of this presentation would be that health is not the absence of disease, it's much more. Health of people, livestock, and ecosystems are clearly interdependent. Livestock health, human health, and wildlife health in the broader ecosystems interacting are the mechanisms by which health threats emerge or subside, and how we manage these collectively and interrelatedly has become an important topic that many have tried to resist for some time. But it is clear that if we would strive to achieve good health in this broader sense, that we must relate these three healths as we proceed. So a few points about health in livestock in nutrition and that relationship to health. Henning may talk in a minute about what is the proportion of protein of livestock. It's about a third, maybe a little less. Some say a little bit more, but livestock is a major contribution, makes a major contribution to protein that we consume. A major contribution to particularly poor people who use even small amounts of livestock, an egg a day or egg a week, to contribute to their nutrition. And if we include fish in all animal source foods, we know that 400 million, the poorest people in Africa and South Asia, fish account for half of their diet, their protein intake. We know too that small amounts of animal protein makes a big difference in the consumption of poor quality diets. This is a crucial reason why people in the Sahel, for example, who consume poor quality millet and sorghum, are still able to be nourished and healthy. But a small number of countries bear most of the burden of malnutrition. And if we were to look at the map, you will see that this is clear. And while 1 billion people are hungry, there are about 2 billion people who are overnourished, and some attribute much of this overnourishment to excessive consumption of livestock products. So livestock and human health, a few points here to be made. It is very true that 60% of human diseases are shared with animals. 75% of the emerging diseases are zoonotic. And 25% of the human infectious disease burden in least developed countries are zoonotic. The top 13 zoonoses are responsible for about 2.4 billion cases of illness and about 2.2 million cases of death. Emerging zoonotic disease associated with intensive systems with hotspots, not only in the high intensive livestock areas in the developing world, but new data show that parts of the United States and Europe can be considered hotspots as well. High burden of the neglected zoonosis diseases are associated with poor livestock keepers, and some of these hotspots are indeed in the developing world. If you were to look at this a little bit, you will see some of the red dots that indicate distribution, as well as some factors of intensity in the case of zoonotic diseases. And you can see where the burden falls. But in terms of incidence, if the bigger the red dot, the more incidents there are. And the blue dot signifies the incidence in 2012. You can see the incidence here, but of the point to note is that the incidents in 2012 are rapidly increasing, and as compared in the past 72 years, you can see what the relative growth, if we were to use that term, or in incidence has been. Let me turn for a moment to the second health, the livestock health itself. Often the discourse is about transboundary diseases, and these are very important indeed. How to control them largely influence our ability to trade. But not only our ability to trade, they also influence how we control diseases at home. As important, however, we'll argue, are the endemic diseases. These are really diseases where the poor bear the brunt. So while we pay considerable attention to transboundary diseases and emerging diseases with pandemic potential, we must also consider that the endemic diseases are the ones that affect the poor the most, and they are bearing the brunt of that. A few charts to show estimates of the losses associated with selected diseases. I have to tell you that these are estimates, rough estimates, because as I will come to in a moment, data collection, reporting diseases in the animal sector is very poor, and our knowledge, our completeness of the information is far from sure. Some more information from various sources on additional estimates on the losses. So the third, health, ecosystems health, and here is where there has been a lot of discourse over the past several years about the livestock sector. The source of greenhouse gases, and I'm sure Henning will come to this in great detail. Livestock feed competes with staple crops for biofuels and for water. It is true, you would see a chart that will show this in a moment. Livestock is a source of disease that spill over into wildlife, so not only wildlife on livestock, but livestock on wildlife. But of course, they contribute tremendous organic matter for poor smallholders. It is said that about 50% of the nitrogen used in agriculture in India comes from manure. Permanent pastures potentially are important for carbon sequestration, and I hope that in future we can do more about this. And production efficiency is key in reducing the livestock footprint. The graph that shows that by 2050 we will need twice as much grain as we produce now, but half of that will go to the livestock sector. A little bit for biofuels, but as much for livestock as will be for human consumption. So as we calculate the footprint of livestock, we calculate the contributions from the crop sector as well, to a large extent. But it is possible to reduce the carbon footprint, and we can see from data in the United States, whilst the carbon footprint per animal has gone up considerably because of higher output, the carbon footprint per unit of product has significantly gone down. And here is a great opportunity for us in the developing world. Improving the productivity of livestock is a key means of escaping poverty, but it's also a key means of reducing the carbon footprint of the sector. And the wild card is that we do not understand all we need to know about the changes, climate change, and what these effects will be on the tree health. So a few points, a few prescriptions before I conclude. And I hate to prescribe. Prescriptions are often wrong, but let me take the liberty, since we're talking about health and medics prescribe, let me play the role of the medics and make a few prescriptions. If we want to deal with sustainable intensification, here are a few things we must do. Manage disease at the animal source, not when it occurs in humans. Up until now, mostly we know that we have a serious problem when it occurs in humans. Humans, in some sense, are sentinels for animal diseases, one can say. Invest in the One Health approach for all the reasons I've just said. These three healths are closely intertwined. And our disciplinary insularity, which has kept us apart so long, is nothing but foolishness for the future. Promote risk-based incentives for food safety. Our approach so far has been regulatory and compliance, but we often are not relating these to the real risk. So let's deal with risk rather than hazards. If we want to, for sustainable intensification, some prescriptions for the animal health sector is to support smallholder systems to improve production and productivity. As I just said, this we get 2 for the price of 1. Well, 3. Certainly we reduce poverty, we get more food, but we also produce more sustainably. Animal health services much improve, and this will depend on technology and innovation. So crucial for delivering good animal health services. And of course, health services more broadly is innovation, not only in animal health, but it's key in animal health. The cheapest way to control diseases is still vaccines, but not only. And let's take a whole value chain approach rather than just treating diseases as we tend to do from a clinical standpoint in the current systems. Sustainable intensification, prescriptions for the ecosystem's health. Up until now, producers have not paid for externalities, a point that Dr. Neppen made earlier. What are the costs of these externalities in the production of livestock commodities, and can they, should we pay for them? Improvements in ruminant production, where particularly there have been there's a huge gap between, performance gap between what is attained and what is feasible. So can we improve ruminant productivity so as to close this performance gap? Reduce livestock-induced deforestation. Much of this has been blamed in the Amazon in Brazil, where we produce large amounts of soybean and so on. But could we substitute certain grains that we use now in the feed systems? Why not sorghum and millet from the dry areas to substitute for maize? Lower energy density, but quite feasible. And of course, deal with manure management, very good techniques there already, but also in terms of the environment, we need to control the use of feed additives and of course wanton use of drugs such as antibiotics. And can we get livestock into payment for environmental services? Can we, as we produce more livestock, get livestock not only producing carbon credits, but also deriving the co-benefits such as better environmental, better water quality. We don't degrade the environment so much, and we have less impact on biodiversity, for example. So, for the policymakers, what are some policy prescriptions, policy advice that I'd like to offer? First of all, we need better surveillance, not only for animal health diseases, but human health and for ecosystems health as well. We have very few indicators for what is good health of the ecosystems. But particularly for diseases, we need better surveillance systems. We do not know what is the real incidence of diseases. We need to do better resource allocation between the endemic diseases and the emerging diseases, particularly those of pandemic with pandemic potential, which have excised us up until now. And a nice quote here from Delia: health is too important to be left to doctors. And cross-cutting support and innovations at all levels in the animal sector, the ecosystems, as well as in human health. Innovation is crucial. And in conclusion, as we talk about how we would feed the world to stabilization of population, it is our belief that we can, feeding the world is possible. We can do so in an environmentally sustainable way. We can do so whilst we're reducing absolute poverty. And we can do so improving the health of people, animals, and the planet. Thank you very much.